Hi, good evening, everyone. Happy New Year to each one of you. It's now 7 p.m., so we're going to give um, those persons who are coming in, give them a few more minutes to log in. So just bear with us. If you have anything that you want to do in the background, you can just turn off your camera, go ahead and do it. And in the next 4 minutes, you can come back on. We will start it promptly at 7:05 just to give other persons time to log in. Thank you so much. I do respect your time. I appreciate you working with me. Thank you.
Good evening, Mr. Perkins. We'll be starting shortly.
Thank you.
Sure.
Yeah, can you also make Dorian co-host? So while I'm speaking, she can just let in persons.
Got it. Okay, thanks.
Thanks. Mhm. Just to alert you if anyone come in because we have experienced such before. If you're logged in and you're on with us and we get bombed, we will be logging off promptly and come back on. But we would like you to identify yourself because we don't want to leave you out. So just to let you know that sometimes it happens as we're letting people and we don't know who they are and they're up to mischief. So if we do experience anything like this, then we will be logging off and come right back in. Sometimes persons don't come back in, so just want to let you know that. Thank you. Okay, so here we are. It is 7:05 promptly. Good evening to each one of you. Happy New Year. and this is our first meeting for the new year. My name is Francisco Leopold. I am the second vice chair on the community board and the chair for the health and social services. As we start a new year, there are so many things that happened in our communities, in the world, in our communities, in our neighborhood, with our families and our friends. And I just want to just leave this with you. Never live your life in the past life. Your past is already gone. Your present is already arrived. Sorry. Your present is already arrived. Forget your past like a nightmare. Greet your present. We're in a new year, 2024. Greet your present like a new dawn. Living in your past means you're committing a crime against you. It is like trapping yourself inside the dark cave and lost your path and withered away. Forget your past and leave whatever happened in 2023 in the past. You only give yourself pain and anxiety and nothing less. Your past only hurts you. Your past only traps you. Your past only disturbs you. Your past only destroy you. Forget your past, kill your past. You never get anything from your past. Focus on your present, live in the present, make your present successful. And I hope that 2024 would be a successful year for you. Anything negative, any baggage, whatever it is, even friends that kept you down in 2023, leave them in 2023 and move on in 2024. Welcome to this, to the committee. And as I look at Shane, please just introduce yourself, and then I will call around as we go around. Go ahead, Shane.
Hi, my name is Shane. I'm one of the doctors at Kings County in SUNY Downstate. And I appreciate you guys taking the time to listen to our spiel.
Thank you. Mr. Clarkson?
Yes, Lilith Clarkson. I'm from the Committee of Interns and Residents, the union that represents Dr. Shane Solger. And again, we appreciate y'all giving us time to talk about what we're going to talk about today. Thank you.
Mr. Perkins?
Hi, good evening. Justin Perkins, excuse me, resident member of this committee. Welcome, everybody. Nice to be here.
Thank you. Dorian?
Sorry, good evening, everyone. My name is Doyen Saab. Yeah, I'm the co-chair for this committee. Happy to see everyone.
Nyasha? Hope I'm pronouncing her name right.
Yes, you have it right. Hi, everyone. Happy New Year. My name is Nyasha Carmichael, and I am a resident member of the community.
Okay, thank you so much, and thanks everyone for coming. So, just one thing I'm asking, one thing, icebreaker, one thing. What is the one thing that you experienced in 2023 and you are leaving it back there, you're not taking it into 2024? The one thing, Shane.
I mean, I'm hoping that this is going to be a great segue into what we're going to ask you for, but it's all of the horrible interactions we'd have with the city for our negotiations.
Okay, I think that you are not leaving it in 2023 because you're still something that you're looking to accomplish to reach some sort of agreement. Mr. Klassen?
I mean, I'm going to, Shane is my general, so I'm going to have to co-sign with him in 2024. I hope that we get a fair and righteous contract for our members that put in that work.
Okay,
So,
Mr. Perkins.
probably not what you're looking for, so you probably should have started some other folks.
Mr. Perkins?
Yeah, for me, I guess just leave those relationships behind that don't really serve me any longer. Leave them in 2023.
So exactly so. Leave bad friends behind.
Yeah.
Yeah. Dorian?
I can negativity. Just want to bring nothing but good vibes into 2024. So
Asha?
That's a good one, Dorian. I would say anxiety of living in like the moment. I want to like get out of that anxiousness and kind of just continue to experience life, taking in all the positives and not all of the things that could go wrong, like in the moment.
All right. Nia, I know that you were doing something. Are you able to speak?
Yes.
Mia? Okay, sure.
Hey,
Oh, go ahead.
friend, I can chat really quickly. Sorry, I just had something, another meeting going on in the background. And sorry, I'm not on camera. Hello, everyone. My name is Mia Hilton, Assistant District Manager at CB9. Happy New Year. Great to have you guys here. I think you guys are in the middle of the icebreaker. And Fran, what is the
What is the one of the things that happened in 2023 that you would like to live in 2023 and not bring it into 2024?
ooh. Um, hmm. That's a hard one for me. I don't know. Maybe, trying to hold myself to unrealistic timelines and
Hmm,
stressing myself out. As
that's a
long as
big
I'm
one.
working on something to get it done consistently, I can learn to be satisfied with that until I get it accomplished instead of setting unrealistic timelines.
That's a big one. Okay, thank you so much. Thanks for taking the
Alrighty,
time.
guys. Thanks.
Well, for me, I'm going with my two sisters, Darian and Ash. Anxiety, stressing myself over things that I cannot change. So I'm looking at whatever comes my way. I'm not a problem solver, and if I can't deal with it, I'm not gonna allow it to take me down or worry me. I'm just gonna leave it and allow it to take its course. That's my aim. Thank you so much, everyone, for taking part. And now we have Shane, and we have Shane. Your name is Sloga. The last name is
It's pronounced Solger, but I just go
Solga.
Shane. It's fine.
Okay. And okay, so welcome, and then we will have the short presentation from you guys. The floor is yours.
Thank you again. Really appreciate you all allowing us to sort of make this presentation. So sorry. Let me put that on mute. Am I able to share my screen? Is that fine? Oh, you disabled participant screen sharing. I do have a PowerPoint, and we kind of wanted to give a visual and
How long
verbal.
is it going to take?
This will be all of 10 minutes, no more than that, friend.
Okay, Mia, can you give them access to share, please?
Granted, he should be able to share now.
All right, thank you so much. Thank you, I appreciate that. All right, so what? Oh, whoops, that's the. I always do that slideshow. So what we wanted to do was sort of talk about our union, because I know most folks are not familiar with our union. Talk a little bit about our work with patient care, and there are two things that we'll talk about. And then we will sort of talk about our contract negotiations and support that we are looking for. So most folks do not know who the Committee of Interns and Residents are. So we do want to do a little bit of background, if that's all right. We are the oldest and largest house staff union. So that's physicians in training, including Dr. Shane Solger in the US. We represent 30,000 members across 11 states. We represent 7,800 members in New York City, across 26 hospitals, Brooklyn, Queens, Bronx, Manhattan, and Westchester. And 435 of our members, physicians that are in county and downstate, are also represented by our union. Terms of our values, we really believe in improving medical resident education and training, really about advancing patient care, protecting and expanding healthcare access for our communities, implementing well-being measures for residents, advocating for patients and ourselves, and engaging the communities we serve. All of this sounds like lip service, so I actually am gonna, before we go to the next slide, ask Shane to talk a little bit about how our union members have been working at the hospital to ensure advancing patient care and engaging the community. So I'll turn it over to Shane before we go to some more slides.
Sure, we can talk about a few things. One would be our Family Health Challenge, where we go into different elementary schools around New York City. And it's an anti-obesity program that's run by residents, with the plan being to teach them healthy habits that they could implement, you know, in a fun way at school, but then also bring home to their parents, especially considering most of us serve communities with lower socioeconomic statuses, where things like obesity, diabetes, high blood pressure run rampant. With regards to Kings County, one of the things that we were able to lobby for successfully was inpatient Haitian Creole speaking interpreters. When I started, we didn't have anybody, and we had, unfortunately, trauma victims, really sick patients coming from nursing homes, pregnant women who were coming to our hospital, and if it was between the hours of 8 p.m. and 8 a.m., they were going to either have an ad hoc interpreter, so someone who maybe sort of knew Creole, or in some unfortunate circumstances, it was somebody who maybe knew French and they would just use that instead. And probably over the course of 6 months, we were able to increase via lobbying through our city council members to change our 8 a.m. to 8 p.m. Video interpretation service to 24-hour service. And we got a commitment from the city to fund in-person interpreters. And this month, we're supposed to be getting 22 staff members that are trained as medical interpreters in Haitian Creole. Some other things we've been able to do through our union is we get tons of like millions of dollars in medical supplies that we actually detract from our paychecks to the Patient Care Trust Fund. And so we've been able to get VR goggles for pain, surgery simulators. Most recently, we were able to get hearing aids for our elderly patients. And we're also able to get child service workers, child life service workers. And so what those are, they're specialists that help us decrease the amount of medication we give children, because they help them work through their pain, you know, especially if they're going through a surgery or a painful procedure. And so those are some of the commitments that we've been able to get from our community and from our hospital through the union.
And so, yeah, I wanted to just sort of highlight that, to just sort of underscore again, as a union, it's not just about sort of bread and butter benefits, but our members are intimately concerned and connected with the patients that they serve at Kings County and at Downstate. And so, you know, again, I didn't want to just sort of read off these values in abstraction, but rather say, no, we do live by these values. And as a union, these are the three things that Shane mentioned are pieces that we have working with the community on, have been able to increase at Kings County. But that is not why we're here today, even though we'd love to talk more about our work at the hospital and community. So I will turn it over to Shane.
Thank you. So just to summarize the status of our contract negotiations, our contract expired in 2021, and this last August, we started new negotiations to renew it. And unfortunately, the negotiation process so far has been mired by the city delaying meetings, coming to the negotiation table without proposals or counter proposals. And in the last 5 to 6 months, the most that they've been willing to offer is to have us delay our future pay raises to fund our own overtime, essentially a plan that has us paying ourselves. We were surprised that after COVID, the city was offering its frontline healthcare workers 3% salary increases, which is far behind the rising cost of living in New York City. A raise of 3% will leave our starting salaries roughly $5,000 below the average starting salary for safety net hospitals in New York. And worse, it leaves us with the lowest salaries of all of the safety net hospitals in New York City. And you might imagine how this would affect recruitment. There are a lot of talented doctors that want to take jobs serving the underserved. However, we're still people, and we have to pay our utilities, rent, and food bills. And in addition to working an 8-hour work week, one might understand how this would leave H&H vulnerable to losing out on many talented applicants. Lilit, you could change the slide. So our goal is to make sure that residents can take care of patients and perform our clinical work without worrying about paying our own bills. Many of us spend time outside of our 80-hour work week trying to improve patient care, whether that's through our sitting on hospital committees, writing grant requests for equipment and money. I'd mentioned some of that before with regards to some of the VR equipment we've been able to get, speaking with all of you as community members, or working on improvement projects throughout our hospitals to deliver the best care that we can and improve upon the care that we're already delivering. However, the city's proposal is making it difficult to draw candidates to our hospital system that'll be inspired to continue the same line of work. And if we opt to make New York City's public hospital physicians the lowest paid, we're going to get talent that reflects that decision. Lid, if you could change the next slide. And so this is our request. We're hoping that you'll write a letter of support that indicates that you want our community hospitals to be able to provide competitive compensation to both recruit and retain our country and state's best physicians, those that are willing to continue to both work inside and outside of the hospital to improve the health of the communities that we serve. We don't want to be paid the most in the city. We just don't want to be paid the least. And we are also, our second ask is that we're hoping that you'd be willing to attend rallies and unity breaks that our members will be hosting throughout the city just to show your support.
That is our presentation. I'll stop sharing. Any questions?
So, are you in negotiation right now? I mean, you are the union, so are you in negotiation? And how long have you been in negotiation?
Yes,
We've
ma'am.
been in. Oh, Shane, go ahead. General, go ahead, Shane.
Sure. So we've been in negotiations since August, was I believe when we had our first meeting with the city.
Okay. And then you're asking for a letter of support from the community board.
Yes, ma'am.
Because I know that you did come to the community board before, but usually you would have to come to the committee as you're doing now. You would have to come to us first, and then we would hear as you just made your presentation, and then it would be presented to the executive, and then we would then take it to the board, to the general board for. So what have really happened, Shane? You put the cart before the horse.
Well, look, and our opinion was, hey, let's talk to the entire board, and
Yeah.
if there is an appetite, then someone would say, you know what, I like this, but you need to go to the Health and Human Services Committee first, and then come back. So you're right. We sort of did the process a little bit backwards, but we did want to ensure that there was an appetite.
So you're doing it right, and we hear you. So, and I know they would have the board, general board, heard your presentation last month. I think it was last month. So I know that the office do have your information. So we'll be meeting with the executive, and it will be brought up with the executive. It will be voted, and whichever way it goes, we'll let you know, and then Mayor will get in touch with you, or the manager will get in touch with you to come back to the board meeting this month and let you know whatever they wish to do. But you thank you so much, and just thank you much for all the work that that you're doing, and really looking out for the community, because most times persons are out there and the work for them is just a paycheck. But we want persons who are committed and not just looking at the dollar signs, but looking at the interests of the people in the community. Bringing value to the work that that you're called upon to do. So we thank you so much on behalf of the Health and Social Services. Thank you for all the work that you're doing. You are this is Health and Social Services. You're in the health field, so if you don't have to run, you can sit with us. You can and as we discuss, you could sit with us and hear what you do. So thank you so much for being here and for the presentation again.
I will actually sit and hear the rest of the meeting, if that is okay with you all, out of a sign of respect.
That's no
Shane,
problem at all.
I'm not sure if you have to go.
Yeah.
Oh no, I have time for this.
Okay. Thanks. All right, so we are looking at Tim. Thank you again, Tim, for being here. We're looking at the senior programs for the year. So as we spoke before, Council Member Rita Joseph, she's very much on board, as well as Assembly Member Cunningham. They're very much on board. So if we have to put a budget together, looking at what we're looking to spend so we have to give this to the board and also send it to the assembly member and the council member as well, as to the programs we want to do for our seniors. So for the summer, I'm looking for us to do and then chime in, and if you have is something that we discuss, but bringing it back to the table, looking to do a spa day for the seniors. So we can utilize either the T building at Kings County, or we can utilize the ballroom at Kingsbrook Hospital. And I think that the last time Miss what's her name from the director at Kingsbrook, she said whenever time if we need to use the facility, we can use the facility. But we are looking for easy access for the seniors and persons who may be in a wheelchair, because we want the doors open to everyone. So we are looking to do manicure, pedicure, hair cutting for the men, for the women, massages, games, and whatever else, you know. We did it last year and it was a success. We had yoga, we had laughing yoga, and then they were very happy. And then they were like, "Are we doing this next month?" And I'm like, "Well, we don't have the money." And so Elite Learners, they provided lunch for, well, we paid for 300 lunches, and then they gave us 50 lunches free. So sorry, 100 lunch we paid for, and they give us 50 free. So we are looking to have giveaways. So some of the seniors they play bingo, and then their gifts were massages, you know, and they were very happy. So we are looking at that, and then we don't necessarily have to go that way. And I'm also looking for us to, you know, a day where we can take them on a senior trip, where we can take them to a Broadway show and then take them for lunch afterwards. So this is what we are looking at. So we're looking at the cost. So we have to, if any one of you have the time, and then you could find out, most likely we could come up with 3 Broadway shows, and preferably the daytime. On a Tuesday, it's cheaper, the senior fee. So we can get that, we can get the hospital, will transport them. If the hospital van cannot take them, the 71st precinct, they are always willing and able to transport the seniors. So we don't have to pay for transportation. They will take them to the city. They will have lunch, they will see the show, and then we'll take them. So we can go either with a trip out and then lunch afterwards, or we can do the seniors are there. If we do get the funding, we may able to do both. So sometime back, we were able to do something we were looking to do it on the outside, but because it was very hot and that particular day it rained. So you're looking to do it early in the year, so we don't have to have them on the inside. And we had a DJ also, Elite Learners, they provided, we showed a movie as well. And they wanted to watch with The Wizard of Oz. They watched that, they were happy with that. And then we had the popcorn machine and everything. So they had the works, you know. So I would really prefer for them to do it on the outside instead of the inside. So we'll get and so again, it's cost. So we can get chairs, we can get tables, but we have to rent the tent, you know, because we don't want to have them in the open element. We want to have the tent for them. So we would rather have a tent, and in the evening time, we can just zip it off, and then they can sit down whilst we serve them with the tea and the audios and stuff, and they can watch a movie and the fruits. We just want to pamper our seniors in the community. So that's where we are when it comes to the seniors. Anyone have any comments, any suggestion, any takeaways when it comes to program for the seniors this year?
Is there a timeline for submitting the budget? And like, how soon do we have to have that in place? Because it seems that we need to get some information on the shows and getting seniors.
Yes. So I would really like us to, by the ending of the month, to be able to put that together. To send it. the earliest or the latest, the first week of February.
Would you like us to decide now which events we're going for, or are we just putting in a proposal for both of the events and then?
I think that we
Funding.
can put in a proposal. At the end of the day, I'm working with you guys. So if you guys think that it is a good thing that we can do both, we can go with both. We could just embark on one. We can do that because when it comes to the trip, it's just paying, just getting the fee, getting the monies for the food to take them out for lunch and the show. We don't have much to do. It's just a matter of paying it. When it comes to the spa day, it takes more. And then we have the last time we had one of the beauty schools, they wanted to come in to the facials, but because it was on a Friday, so they were not able to come. They wanted to be on a weekend. So we have to look for somebody or an organization that they are able to do it on a Friday, on a weekday, because Saturdays are not good for me. So I will not be able to make it on a Saturday. So with the floor is open. What do you guys think? Should we embark on both, or we should do one now? Because I guess we can do one earlier in the year, and the next 6 months, the first 6 months of the year, we can do one, and do the other one the next 6 months. What do you all think?
I just have one more last question. Would this impact like other programming for other, like, I don't know, communities we would want to focus on? So if you wanted to do something on like maternal health, if like we do 2 events for seniors, would this impact funding to do an additional event?
No, because we'll get to that. That question remind me. The next discussion will be touching on that, and that's a great question. Go ahead, Justin. I noticed that you had you unmuted yourself.
Oh yeah, I was just excuse me. I was also just curious. So what was the turnout for last year, numbers wise?
So numbers wise, we had it was done at the T building, and 100 people registered, and we had to turn away people. Yeah. So we catered for 100 persons registered, and when we catered for 150. So persons were still calling, and when we had to turn them down. But out of the 100, the full 100 didn't turn out, because if you remember, it was August 25th, and we had to stop that day. And I was so surprised that no persons came out. I couldn't believe that, and I saw seniors walking, and I was stunned. Yeah. So yeah, and they were asking, they says, hey, are we gonna do this next month? we had fun, so they wanted to come back again very soon.
I don't know. So for me, like, I think we do for both, right? I mean, I'm always just like, go for it, go for as much as you can, and then see what happens. But yeah, so maybe I don't know. I guess it also depends, like, what time of year. I mean, maybe this one, maybe the Broadway show one first, because it's like less legwork involved with the planning, and less moving parts, right? And then
Right.
the spa day later in the year. But I mean, I say we should do both if we can.
Okay. Point taken. Dorian?
Yeah, I mean, I think 2 is fine. Yeah, shoot for gold, or what is it? Shoot for, I don't know what the saying is, or shooting for the stars. So let's try for 2. I like them
Yeah.
both.
What's about Anisha?
Yeah, I agree. Completely agree. We can submit both, and once they're accepted, or we have to edit or anything like that, we have a timeline of getting. I think the Broadway show would be much easier to do in the first half of the year, and then we can plan the spa activities.
Okay. Thank you, guys. So going right into the next item, mental health. So we are partnering with Congresswoman Yvette Clarke's office, Senator Myri's office, Assembly Member Cunningham office, and Council Member Rita Joseph office, as well as the Borough President office. So for mental health, we are minusing the Borough President. And then, so we'll be working with Downstate. We are looking to do a mental health summit in May. So these are these persons who will be really be at the table and put and I mean you guys as well sitting at the table to put this together. So we are looking May is Mental Health Month. So as a matter of fact, today I had to work on a proposal to send to the Congresswoman's office. So the Senator Myri's office and the Congresswoman's office, they're the two persons who are really pushing because they're looking for us to not having just one summit or do a forum just once a year, that we can push it to do at least two for the year. And I think that it will be a little bit much, 2 for the year, because also we are looking to do maternal health. Now, maternal health is big for us in the community. So when it comes to maternal health, oh man, I forget her name. The leader for the Democratic Committee, Ms. Hamlin, her first name. Can someone help me? I forget her name. She's an assembly member.
Is it
But then she is
Rosalind?
huh?
Rosalind? Hamlin?
It's not Rosalind. It's Hamlin. Bishop something. I just don't remember the first name. I don't know why it just left me. But she will be conducting. She'll be on board with that. Also the public advocate and the borough president, as well as the Clara Lewis. So we have persons who will be working with us, will be pushing, and because we want it to be a success. We don't want to have a forum, a summit, and it's just like 8 people showing. So for me, we are already working the works in the pipeline for the mental health. So we're looking at mental health, how it affects young children, because when you look at an 11-year-old child committing suicide, you know something is definitely wrong, you know. And then the last time I met with Councilmember Joseph, and you know, she was saying, Miss Leopold, you know, it's not out there in the news, but there are so many young people killing themselves. And even in Manhattan, some of them, they just jump off the campus. They just go on the roof and they jump off. Sometimes you hear of it, or sometimes you just keep it hush hush. So we are looking to really push in our community, bringing awareness into our community and in the schools. And one of the schools that has opened their doors for us to work with them, and then we have we are not only looking for, we have persons, doctors from Downstate, behavioral health at Kings County and Downstate, who will be going into the schools, who will be talking to the young people, you know, because many times you find that when children are in front of their parents, they just shy down, they don't talk. But if they're just talking away from their parents, they are able to open up, and if you ask questions, they can ask questions. And some of those kids, they're experiencing things at home, you know, they're experiencing in the school, outside, in the community. They're going through so much. And sometimes what some of the parents do, they just have a blind eye because changes come, but they're not looking at the changes in the kids, the things that they used to do, laughing, talking, eating, playing, want to be outside. They just want to close themselves in the door in their rooms, and parents are so busy, they are not paying. So we are tapping into the PTA at the schools. So that is what we are looking to do. So MS61, they have opened the doors and they're very happy that we will be going into the schools because as a board, just being here and just every month when we're just talking, it really doesn't profit the community or us. We are just there talking, and when we leave, we say bye. We need to go out there. We need to start doing the work, doing the work, bringing people, invite other persons. I know many of you will know persons out there working in the communities, and based on the work that they are doing, that you could bring them on board so they could work, or they can work with us. So we are looking to, if you know of any persons who in the health field will be able to help us when it comes to putting a panel together, because we don't want to sit at a table just talking. Hey, this person attacked this person on the platform, on the subway. This person did this, and this person did that. This person committed suicide. Yes, it's a discussion, but we want persons to come in at the discussion and say, hey, we want testimonials. Persons who could come out and say, hey, I had a loved one who committed suicide. I experienced mental health issues. I experienced this. This is how it affected me. You know, so just someone who could really say, hey, I've experienced this, I've been there, I know what it's about. But not only that, many a times when you have forums like this, is just like left hanging. What's the solution? What do we plan to do about it? How we are able to, what are we bringing to the table to solve the issue? You know, and then we have our young people, they're going older and older and older, and then whatever they are going through, there's nothing to solve to help them to deal with their minds. We want them to get their minds right. And that's what we are looking to do, to go into the schools, to tap into the school, to talk to them, to have a conversation with them. So when it comes, and then we have a lot of mothers who are out there, and then they're working, they're single mothers, and they are going through stuff as well. And when you look at mental health, it's not just affecting just the children, but it goes right into maternal health. You know, how it affects persons, the services that they are getting, receiving. But we are not going to tie both of them together. We will do mental health now, because mental health awareness month is in May. So we'll deal with that. We will be having the symposium at Downstate. I will send out the meeting notice as to when we will be meeting, forming the committee to discuss. It will be from 11 o'clock to 3, so lunch will be served for everyone. So in the morning, we'll have the discussion. In the afternoon, what we are looking to do, the panel then will come up with solutions as to how we can help our communities, how we can help our young ones, how we can help the elderly. They are facing mental issues as well. It's across the board, you know. So this is what we're looking at. And then after this, then we will be embarking on maternal health. All right, so this will be, it is just us into the planning, but we have, you know, a charter of persons coming together to put this together. Any questions, any comments, anything that anyone wants to say? I said a lot, my mouth is tired.
Was the meeting going to be in person for forming the committee, or is it virtual as well?
It will be virtual because a lot of persons, there are different areas.
Yeah.
So when we meet, we'll meet in person just at the planning committee. So I will be, by next week, I'll be sending out a meeting notice. So it will be virtual.
Okay, that works.
Okay, I think virtual is better because persons don't have to be running from one place to the other. You know, so.
Yes, I agree.
Yeah. So based on what I've just said with the mental health summit, any takeaways? And Shane, and is Lalit, that's how you pronounce your name? Anyone?
Yeah.
Hey, it's a committee. The meeting is open to everybody, so don't just
No,
sit
for
there.
sure, for
Just
sure. Yeah, I mean,
listen.
I would definitely say, and Shane would probably echo. I mean, we have members that are psychiatrists, and
Mhm.
so we have child psychiatrists, adult psychiatrists. So I think, yeah, definitely would like to maybe get more information, and pass that along to see if any of our members that are psychiatrists and or child psychiatrists, either interested in participating or, you know, again, if you're opening it up. And then if you are, you were talking about having a community event potentially at the T building at Kings County. Would love a flyer for that. Again, our members interact with patients old and young all the time. And we've, you know, at times sort of had flyers and given flyers out to community members. Again, at county. So that was just sort of my sort of two thoughts based on, again, what sounds like some really good work on behalf of the people.
Yeah. So Shane, you have my I think you based on the email you have, do you have my information?
I believe Lilit might have your information.
Well, we have information from Dante. For
Okay,
someone
so
in-
you can get, yeah, so you can get my information. Then you have my telephone number, and he
Okay.
also have my email address. So just send me an email, or I can send you an email so that we can, because I'd really like to tap in with have a dialogue with the child psychiatrist. I would really like that. Because also I would like someone that when we go into the schools, because for the parents, we will be meeting with them, we'll be having our meetings with them online. But then with the children, we will be having our meetings with them in person. So we're looking for someone who have the time and to place it in the schedule that they can go into the schools with us and they can have a one-on-one with the children. So that's what we're looking at.
Yeah,
Shane, I don't
Hi,
know if there's
Yusuf,
anything.
how are you?
Yeah, I was gonna say with regards to the flyers in the past, we have included I think it was for the community fund, like I forgot the official name for it, but where like each of the communities gets to vote on how the city money is spent. I remember we were handing out flyers just with our discharge paperwork. And so I would see, I could see something similar because I mean a lot of the people who visit our emergency department and clinics are elderly and would probably benefit from this. So, I'm just like thinking, but please reach out to us afterwards, or we'll touch base with you just to see how we can brainstorm kind of disseminating it to the patients that we do see.
Yeah, that's great. But when it comes to for now, as the others have said, we will have the two events for the seniors. So the first part of the year we will do the Broadway show and lunch afterwards. So we'll be talking with the hospital to see who will provide so as anything as what we are not we have to really be careful because when the one person's here, we're going to the Broadway show and food and lunch, everybody will want to come. So we may not be able to accommodate 100 persons. So we have to come up with like a number that we're really we're looking at. So if we put it out there, we'll get a lot of persons, registering who would like to go. So we have to play it safe as to how we deal with that, how we handle that. How do we go about putting it out there and then inviting persons to go? Right. So most likely we may have to say, well, the first 25 persons or the first 50 persons who registered, that they are the ones who will be going. So if you'll have any ideas on that. And then there are restaurants. I know there are some places in the city where they have the shows you can sit, watch, and I'm not certain when it comes to the Broadway shows. I know the movie theaters, you could eat and watch a movie. I'm not sure for the Broadway shows. So then we'll have to like really go online and check to see where they have good meal for them. We don't want anything that that could have just stayed home. So we just want a good meal, nutritious food for them. So where we can get a good seniors discount, and as well as we can come up with 3 Broadway shows, and we'll vote on them and choose which ones that we would like to take them to. And then so that gives us enough time to and then also when it comes to the mental health, so this is we will be working on that. Dorian, I think you have Yusuf and I share our WhatsApp group. So the community members, they're part of the WhatsApp group. So Dorian had created the WhatsApp group. So each person, I'm sure that you would have received an invite. So any ideas you come up with, if you get any information on a Broadway show or maybe a restaurant, whatever information, I keep checking it, but I'm not seeing any movement in there. Just put information, because we are meeting once a month, but we are able to communicate with each other via WhatsApp. So put your information in there, and then we'll be able to take it from there. And if it need be, because we can also have, because we were looking to have a working meeting, but because the date that I was asking for, because of the holidays, so we could not have the working meeting. So we can also have, we can also have a working meeting, for half an hour, just meet together and have a quick discussion. But WhatsApp, just put in information in WhatsApp, and then we could communicate with each other. Any questions you have, any comments, or if you come across any, anything that you want to share, just put it in there. Dorian, I'm assuming you have them, right?
Yeah. So I started the WhatsApp. So if anybody wants to join, I guess they can just email Mia or the office.
So I think Justin is part of our committee. So add him in there. Nyasha is part of the committee. And
Okay.
then and you, sir. So you can put them in there. We have other persons there as well. If you pull up the agenda that Mia sent out, you would see all the persons who are part of our committee. So you can just add them in the WhatsApp group.
Okay.
Okay. All right. So any questions?
Francesca,
Yeah,
I
go
was just
ahead.
going to add something about the youth forum. So, I mean, just
Mhm.
an idea would be to maybe we can collaborate with New York City Department of Health. They have they launched
For the youth forum.
Yes, they launched a new app. Well, it's not an app, but it's an online therapy. It's free for teens 13 to 17, and they could speak to a therapist at no
Okay.
cost. I think it's called Talkspace or Peerspace, something like that. But I work for the City Department of Health, so I can find someone who could possibly collaborate with us.
Okay, cool. And even as you do that, and if you could find someone, because I'm a solid person when it comes to the mental health, and the persons that you think that would be able to be part of the panel, you could let me know as well.
Yeah.
Okay, Mr. Clarkson, you had something to say? No? Oh, I see. Like I thought that I saw your hand. Oh, I'm sorry. Oh, it was my mouse calling you. Okay, so if no one else have any comments or anything to say, remember, committee, that the WhatsApp group is up, so you can just go. If you I'm assuming that Dorian will add the persons in there, so you'll see your message, and then we could communicate via WhatsApp before we meet, and then we'll take it from there. So if you are able to get an information, and I will be doing my side work as well when it comes to Broadway shows, so we could compare, just put it in the chat which Broadway shows that you're interested in, and then we'll compare, we'll vote on that, and then also we'll put a proposal together as to how many persons you think we should really look into taking. 25, 20, 25 for the
What's the
seniors.
place of the transport? Like, can we get 2 vehicles to transport people, or like
So,
how many?
Yeah, definitely. We'll just talk to, because I think each one of the vans at the hospital may hold maybe 8 or 12 based on the size. Yeah, so I can always speak to the CEO or the public affairs and ask them as to how many we can reserve. And if we cannot work with them, then the 67% or the 71st%, they always pick up the seniors and take them wherever that we want them to go. So we can work with them as well. So we don't have to worry about transportation. We just have to worry about the tickets, and usually the Tuesday matinee, the Tuesday midday, it's cheaper. So we can look at the Tuesday and then also look at a restaurant that's close to the area where we are going. So that
Okay.
from there, you don't have to travel too far. They can just go straight
So
in.
we've never done a one of this before. Is that correct? Or we've
No,
been
when we planned it, and then when we planned it, COVID came, so we had to squash it. So we never did it.
Okay, so
Yes,
any
we-
show
yeah.
is up for grabs. All right.
Because we are planning it, and there were three, and then I think it was something on the roof. What's the name of the all ages catching up with me?
Fiddler on the Roof.
Fiddler on the Roof. I think Fiddler on the Roof or something like that. That's what they wanted to watch at the time. So we have to see what they have, because a lot of the Broadway shows has shut down since. So we have to see what's there. And so I have working advantage for as a city worker. I think, Darian, if you have it, I don't know if you have it. So I have a working advantage, and it gives you a list of all the Broadway shows and the days and the prices and everything. So I'll be looking at that as well. Okay. So if we don't have any other comments, I thank you guys for coming. Shane, thank you guys so much. Your presentation, it will be discussed with the executive, and then we will take it from there, and they will get in touch with you for the meeting for the month, the general board meeting. So we'll be seeing you again. Thank you for the presentation. Thank you, Mr. Claxton, for being here with us. And all of you, thank you for participating, for being here, and we're looking forward to a successful and productive 2024. Have a good night, and stay safe until we meet again.
Good night,
everyone.
Thank you. Good
Good
night.
night. Okay.